Eye Care. Glad to be with you today. I'll be talking about some cosmetic procedures, mainly kind of non-surgical procedures that you can have done kind of in the office. I've been in practice for a little bit over 30 years here at LO Eye Care for 20 years. I do what's called ophthalmic plastic and reconstructive surgery, kind of oculoplastic surgery for short, which is an ophthalmologist trained in plastic and reconstructive surgery, doing eyelid, lower eyelid surgery, tear duct surgery, other types of things, but we do cosmetic procedures here as well with regards to Botox and fillers. What we'll mainly be discussing today, or anything that's on anyone's mind.
Good. So we have one of the questions that was sent in is, what's the difference between Botox and fillers?
Okay, good question, which some people kind of think they're interchangeable, which they're separate. Botox is, we like to think of as a particular type of chemical that deactivates the muscle. It affects the nerves that innervate the muscle itself, so it relaxes, the muscle. Very safe, been used since the late 1980s, is FDA approved for facial spasms, and then until the mid 1990s it was then FDA approved for cosmetic purposes. So it's designed to reduce the wrinkles and facial expression naturally. Fillers themselves, they actually restore volume, so you can think of it as kind of inflating the tissue. Mainly, you can think of using Botox in the upper facial area, whereas fillers are mainly used in the lower facial area.
And somebody would like to know, how young can I start getting injections?
Okay. Yeah, good question. I guess personally I've done types of injections, either fillers or Botox, in someone kind of maybe even in their mid-20s. I probably wouldn't recommend it in a teenager. We don't live in LA. But there are times when there's either some asymmetry or concerns, but probably maybe typically the earliest for me would be someone in their 30s. That wouldn't be atypical for someone having a little bit of the Botox or a little fillers.
Okay. So if somebody was to go ahead with Botox, what do they have to do to prepare? Is there anything that they have to do? Or?
Yeah, it's a matter of kind of where you're giving it in the facial area. The most common is kind of in between the eyebrow area and the mid-facial area, what we'll call the Kybella region. It's kind of the go-to spot that people may start with, but it can be given in the upper forehead area and in the crow's feet. Generally, like for fillers as well as Botox, ask that people refrain from using anything that can kind of thin the blood, result in bruising, such as aspirin, other blood thinners that individuals may be on, even things like ibuprofen, Advil. Hold off probably about a week prior to that. Not so much maybe in the upper facial, kind of the mid-forehead and then the forehead area, but definitely kind of around the area, which is a little thinner skin around that. Even if you didn't, or even if you stopped the blood thinner, you could have a little bit of bruising, in that area, either with Botox or fillers. But diminishing the anticoagulant like aspirin or anything else will help minimize that for sure.
Okay. And everybody wants to know, does Botox hurt?
Yeah.
When you're putting it in?
I'm a little bit of a sting that you'll notice from it. Sometimes we can do things like a little ice pack. So generally someone starting out, we sort of find out maybe their pain threshold. If someone's really, really sensitive to that, we can do a couple of things. One, we can put like an ice pack on prior to the injection. Other things, we can put a topical cream, particularly the thin skin around the eyelid area, like for the crow's feet area. A topical anesthetic cream that's put on for maybe 20 or 30 minutes is very effective of reducing any kind of stinging or burning in that area. But most of the time, it's tolerable.
Okay.
No pain, no gain.
What is Andrea Ryan says hello,
okay.
And she says, what's good to use for bags under your eyes?
Right. Good question, and probably not a lot of home remedies work, for one, or anything that you kind of as seen on TV. It's a matter of a contour changes. Sometimes it can be hereditary. Somebody may have a fullness in the lower eyelid area, and you sort of get a little drop off, from around beneath the eye, kind of into the chin or the cheek area. There's sometimes surgery, is needed, even in someone that's maybe 30 or 40 or 50 years old. Sometimes a laser tightening can be done. We're mentioning fillers. Mainly the fillers are used sort of in the upper or the lower facial area, but in the lower eyelid where one may have what we call that trough, that little sort of depression in that portion. We've had really good results with that. So it's non-surgical, so sometimes it can be combined with resurfacing. So most of the time it's kind of a shadowing effect. There may be times where there's some coloration, some pigmentation changes that may result in either laser removal or lightening in that area, sometimes topical medications, but we haven't found the secret potion, to say, okay, use this cream and it will kind of be effective. So, but it really takes a personal one-on-one evaluation and kind of find out. We typically try to start with something that's non-surgical to do.
And they'd like to know, how does Botox work exactly, and how long would it last?
It works by interfering with what we'll call the transmitter substance. So, and the neuron that fires it releases what's called acetylcholine that lands on the nerve site and then activates the muscle. So you can think of it, it sort of binds to that receptor first. So the chemical is there, but there's nowhere for it to go. And in an analogy from the standpoint what it results in, it's like someone unplugging your vacuum cleaner from the wall. The current is still there, but it's just not working itself, so it deactivates. The muscle is still there, it's just not any nerve impulse firing. Typically the lasting effect is about 3 or 4 months, and then that compound disintegrates, and then it's kind of back to where it was before. So it's not any risk of any permanent effect. And that's one thing I typically like about it, because somebody can try it and it's not like you're trying something that's going to have a permanent lasting effect. If you don't like it, guess what? It's 2 or 3 months and you're back to where you were before.
Okay. And will somebody, so if that's the case, then Botox probably doesn't make anybody look too fake then.
Yeah.
Or is it, if it's too heavy,
right?
the different levels?
Yeah, that's at least that's maybe the philosophy that we have here. We want it to look natural. Could you have some volume injected that you look like a desperate housewife? You could, but that's not really our goal. We want it to be natural. It may sort of relax the facial area. And a lot of times the most common area where it's given in the central portion of the forehead is kind of associated with sort of unpleasant expressions, scowling and that type of thing. We have plenty of like first grade or second grade teachers that come in and go, I don't want to look angry all the time at my kids. So those are some of the things that are minimized. So it's more of sort of unpleasant facial expressions. We sort of joke around that sometimes if you don't have as much expression, that if it's a spouse or whatever, that the wife, instead of just sort of giving a mean look to their husband, they may have to be more vocal and verbal in communication. But most of the time, the nice thing about it is that you do have still some expression in that area. So I don't really like to, what I would say, de-animate someone's facial area. You may take all the wrinkles away, but we use so mild facial expressions that it's important to maintain that.
Okay. And are there any long-term side effects of having Botox done too frequently?
Not that's been reported. And as I said, it's been FDA approved for a condition called blepharospasm, which as ophthalmologists, we were actually one of the first group to inject it, as well as the neurologist. So we're talking 28 years that it's been FDA approved without any, profound side effects. So it has a great safety profile. Probably in certain indications, maybe in individuals with neurological situations, myasthenia or Parkinson's, that one may adjust the dosage, but it doesn't cause, anything. So there hasn't been anything that it's related to or caused. We don't really give it in pregnancy because it's not known what the effects would be. So that would be a contraindication. Say if someone is pregnant and they wanted it, we just have to wait. But no known effects.
And Jim is asking, isn't Botox actually a poison?
We try not to use that term around, or a toxin. We like to say, instead of a toxin or a poison, it's a purified protein. But it is true that it is derived from the botulinum toxin from food poisoning. So who would have thought it, as they say, but who would have thought that we'd be having penicillin from a mold that's growing on a petri dish either? So these things are sort of strange aspects, and it was actually first developed or promoted and introduced by an ophthalmologist, Dr. Scott, in San Francisco, and trying to think of a non-surgical way to treat crossed eyes in kids, knowing that the effect of botulinum in humans is it impairs the muscle function. But this is just such a purified protein, it's such a small amount. We're talking 20 units typically that's given in an individual. For one to have sort of systemic problems that would interfere with breathing, you'd have to kind of give 10,000s of units with that. So it's very, very safe.
Okay, and if we move on from Botox,
okay,
we also offer Kybella.
Right.
And could you explain what Kybella is for those of us who don't know or
Sure.
are not familiar yet?
Yeah, I guess in plastic surgery, everyone's kind of looking maybe for different holy grails. So that's non-surgical, like, okay, facelift in a bottle, filler in a bottle, or that type of thing. Kybella, it's spelled Kybella, is a chemical. It's not a toxin. It's actually a deoxycholic acid is the chemical name from it. It is sort of unusual in the fact that it is from bile acid. So, so you think that as this plastic surgery, we go, where can we get some of these things that haven't been used before? So it is a compound that's given into primarily the area beneath the chin, in the neck area, that it degrades and destroys the ruptures of the fat cells. So it's a relatively new FDA-approved, item that's very effective in treatment of the area. So it's non-surgical, not for everyone, but we've used it here very safely and effectively. But patient selection is important because we can generally tell which individuals, typically a younger individual with a little bit more fullness in the neck area, can have the treatments, whereas someone with a lot of redundancy of the skin changes, they may not be a good candidate. So it's not just for every neck condition, but definitely hits a spot where people wouldn't really want any surgery, but really get a good effect from it.
Are the effects of Kybella, is it permanent?
Exactly. Yep, it is permanent, because once you sort of destroy the fat cell, it doesn't kind of grow back at all, and so that's the key behind it.
All right. And what's the difference between, you talked about having like the looser skin, and so would that be a candidate more for surgery rather than the ones you said were fuller? So they would be the perfect candidates for the Kybella.
Right. Yep.
And does that normally include a consultation? They have to come in and see?
Yeah, definitely a consultation, and we take some photographs kind of straight ahead and for the side, find out, explain to individuals what all is involved with the recovery, process. Kybella is very effective, but it's different from Botox and filler. The main difference is there's some recovery time, with it. In other words, that fullness will actually get worse before it gets better. So it's not something to have, I'm just going to go to a class reunion and I'll have Kybella. Not the thing to do. You may have filler or Botox before the class reunion and do great, but not so much with Kybella. So there's a little bit more recovery period with it, an explanation before it gets better, and whether or not you may need 1, 2, or more treatments, where say with Botox and filler it's one treatment, whereas in Kybella it's multiple treatments. It could be 1, could be 2, could be 3, could be even more than that.
Okay, so it just depends on...
Exactly, so it just kind of the patient selection and kind of a little conference to kind of find out, is that indicated.
Okay. And what do the Kybella injections feel like for somebody?
Well, we put a topical anesthetic on, so that blunts the effect. A little bit of stinging with it, so I won't lie to you from that standpoint. Afterwards, there'll be some degree of swelling, a little bit of numbness, in that area. Depending upon how much fat is there, it may actually feel weird from the aspect of sort of a sloshy appearance. It doesn't, puff up, like a chipmunk, anything, but it may enlarge a little bit more and a little bit of redness in that, area. But the actual injections typically aren't that painful, but a little bit of stinging, with it, so it's tolerable. So it's sort of the after effect with it, some slight numbness, some slight redness with the Kybella injection.
Okay. And where can anybody find before and after photos? are they on your website or?
Yeah, we have some on our website, and since some of these things are so individualized, whether one wants Botox or whether needs a filler, we have actually before and after photographs of patients of ours that we can show, individuals in our brochures. We have before and after surgical, cases and that type of thing. So since a lot of things are so individualized and we can take photographs before, we don't really have any imagery of kind of projecting what it would look like. There's kind of pluses and minuses, I think, in doing that, but we do have actual patients that we treated with all these types of conditions before and afters.
Okay. And for the injections, I hear during the month of May you have a few offers?
Exactly, right? And so for the month of May, if I can look on, we have with Botox for 20 units, which is typical what would be needed kind of in this central area or sort of the crow's feet. There's $50 off of the Botox injection. For fillers, either one of our family of fillers, there's $100 off of that injection. And then for the Kybella, it's $150 off of a single Kybella treatment.
Okay, good. There are a few cosmetic procedures for dry eyes that you guys do here. Could you name a few?
Yeah, for dry eye, again, that kind of takes a comprehensive examination of what kind of medical conditions that they may have. It could be as simple as recommendations of a particular type of dry eye drop or a prescription drop. Sometimes we can put a small little plug that kind of helps the individuals maintain their own natural tears. So again, that's sort of a spectrum, whether it's mild, moderate, or severe. Severe problems may need all three. Some plugs, prescription drops like Restasis, Xiidra is another newer eye drop to use versus any other kind of compounds. And find out if it's associated with any other type of diseases, like a Sjogren's disease is an autoimmune disease, maybe first presented with dry eye and dry mouth by the ophthalmologist that may require rheumatological evaluation. So some systemic diseases or medications that individuals on may alter it, but it is something that ophthalmologists we commonly see as oculoplastics. We see that, and particularly if we're looking at someone having eyelid surgery, we want to make sure that they don't have any dry eye that could be worsened slightly after having eyelid surgery.
Okay, perfect. Somebody's asking, they've been using dry eye drops for about 4 times a day for months and there's no relief. What would be the possible next step?
Yeah. There's some testing that we can do, objective testing in the office, what we call osmolarity testing. And that tests the saltwater concentration in the tears. The normal value of that is around 300. If it's a higher value, meaning that there's less water there, that can really be an indicative test of dryness of the eye. We also typically put a staining drop in to find out what we call the tear film, how quickly that evaporates. So besides just asking someone how their eyes are feeling, we have some objective data, like someone checking someone's blood pressure or someone checking someone's blood sugar. So we can have some objective data, and that can act as an endpoint to find out, because there may be other conditions that individuals have, allergies, other types of things that aren't dry eye at all. So first it is establishing, do you or don't you have dry eye, and then if you do, then sort of a stair-step approach. If it hasn't been effective with using sort of drops, then maybe the next step is a prescription drop or punctal plugs or different types of things to use. One frequent type of a problem is the production of the oil from the oil glands themselves. And I'm a big proponent of omega-3 fish oils, and we have a great product here that's easy on the stomach. A lot of times people want to take it but can't take it because of the fishy taste. But this particular product is well absorbed in the GI tract and doesn't really result in a fishy or burpy taste. It really can be effective. So we kind of take it from a holistic. We don't hand out just prescriptions and say, okay, this will take care of the problem. So we look at it, and it can vary. That's a particular thing with dry eye. In the winter, with low humidity, the heat being on, and visual tasks, people on computers and cell phones all day long, not blinking as often. So there's some things that we kind of take into account, just practical tips that may be helpful.
Perfect. Well, thank you so much. And for more information on cosmetic options and for consultations, they can visit loi.com.
All right, thanks.